India today has now recorded over 12,000 new cases of COVID and around 10,700 recoveries that have been made in the last 24 hours. The active caseload currently stands at 67,556. So consecutively, Mayank, we are looking at over 10,000 cases that are being reported almost on a daily basis.
Well, absolutely, and not only that the cases of COVID-19 have surpassed 10,000 mark for a number of days now. The number of deaths as well, in the last 24 hours have surpassed the level of 40. Remember, 32 deaths have been recorded in the last 24 hours, while 10 deaths, were recorded were reconciled deaths as per the guidelines of the ICMR. And keeping all that in mind, Union Health Ministry just yesterday wrote to the 8 states which are contributing maximum number of COVID-19 cases. And they have, the Union Health Ministry has asked all those states reporting maximum number of cases to, ramp up their facilities and also testing to ensure that there is no untoward, situation related to COVID-19 in the country. Apart from that, the rate of hospitalization continues to remain low, and that was also given in that letter written to 8 states. So the trend that we are seeing for the last 1 month or so, so that trend continues to exist, and that is a welcome sign. However, the number of cases refuse to go down, and that will, come as a sort of concern for policymakers, because there is a particular, sub-variant of the Omicron variant that is driving the surge, and that is the reason, all across the country we are seeing the number of cases going in upwards of 10,000 for a number of days now.
Right, but Mayank, how do we understand the current situation? Even if we talk about Delhi, that has been one of the major contributors in those overall numbers that have been now adding up.
Yes, Amita. So see, there are a number of states, which are reporting a number of cases which are in excess of, 1,000 or, 2 to 3,000 compared to the others, which are not reporting significant number of cases. And the reason, some of the reasons that experts are pointing out that dense population can be one of the reasons. While, one particular theme is, being observed across the country, that is the rate of hospiitalization and the severity of disease.
Well, that is only the good part, but it becomes all the more difficult also to identify the symptoms till the time one gets tested for COVID, till the time the report comes out. For the moment, Mayank, thank you very much for joining in. So there is no chance for complacency or even to being careless there. Mask up and be safe. Over 12,000 cases India has reported in the last 24 hours.